Good day, guys. So we have been discussing about menstrual abnormalities in earlier videos. So in this video, we'll study about amenorrhea and its types. So starting with the definition of amenorrhea. Amenorrhea is nothing but absence of menstruation. And that is of two types. Number one is primary, and number two is secondary. And we'll discuss about the types of amenorrhea in detail in this video. So starting with primary amenorrhea. So it's defined as either absence of menarche at 15 years of age. However, the female has normal development of secondary sexual characters. So, or it could be absence of menses at 13 years of age in females, but there would be no development of secondary sexual characteristics. Alright, so either the patient has absence of menarche at 15 years of age, but they have normal secondary sexual characteristics, or there would be absence of menses at 13 years of age and there would be no secondary sexual characteristics. And now we'll study about the etiology or causes of primary amenorrhea. So the first cause is due to constitutional growth delay. In the sense, the female has normal pubertal development, but there would be adrenarche and gonadarche that will be developed at later age. The pubertic development will be normal, but the growth of adrenal glands and gonads would be delayed. So in that situations, so there will be decreased secretion of gonadotrophin releasing hormone. So as a result, there would be decreased secretion of FSH and LH, which is follicle stimulating and luteinizing hormone. So as a result of, there would be decreased release of progesterone as well as estrogen at prepubertal level. So this occurs at prepubertal level. So this is one of the causes of primary amenorrhea. And now there is another cause which should be due to hypogonadotrophic hypogonadism. So some examples include Kallmann syndrome, and it could be central nervous system tumors, right? So in this situation, there would be deficiency of gonadotrophin releasing hormone. So there would be deficiency of gonadotrophin releasing hormone, as a result of which the gonadotrophin releasing hormone is secreted in low level, or there would be absence. But the follicle stimulating hormone and the luteinizing hormone, either it will be normal or it will be low, and there would be decreased production of estrogen as well as progesterone. Alright, now we have another cause which would be due to hypergonadotrophic hypogonadism. So in this situation, the GnRH is released in normal levels, but the ovaries of the female, they refuse or they fail to produce estrogen and progesterone. So example would be Turner syndrome. So in this situation, there would be increased secretion of gonadotrophin releasing hormone. As a result, FSH and LH would be high, but because of the problem with the ovaries, there would be decreased secretion of progesterone and estrogen. Alright, and coming to the next etiology of primary amenorrhea, we also have anatomic anomalies. In this condition, there could be outflow tract obstruction. However, the puberty will be normal. So the examples would be transverse vaginal septum, or there could be vaginal atresia, or the hymen would be imperforate, and some Mullerian agenesis. So these are some of the examples or some of the anatomic anomalies which cause primary amenorrhea, and as a result of which the gonadotrophin releasing hormone, the follicle stimulating hormone and luteinizing hormone and estrogen, progesterone, everything would be within normal limits. Alright, so coming to the final etiology of primary amenorrhea is due to receptor and enzyme abnormalities, right? As a result of which some examples would be androgen insensitivity syndrome, or it could be 5-alpha reductase deficiency, or it could be congenital adrenal hyperplasia, so as a result of which there would the gonadotrophin releasing hormone is secreted in normal limits, would be normal, but the follicle stimulating hormone and luteinizing hormone is either normal or high, and the estrogen and progesterone is also normal or high. So these are the causes of the etiology of second primary amenorrhea. Now we'll study about the clinical features. So the clinical features usually depends on the underlying cause. All right. So the clinical features depend on underlying cause. So next we'll study about the diagnostics of primary amenorrhea. So however, since there is amenorrhea, we have to evaluate the pregnancy test, make sure that the patient is not pregnant. So the pregnancy test shall be negative, and we also check for secondary characteristics and anatomical anomalies. Alright. So just in case if the uterus is absent, we got to rule out could be MRKH syndrome, so that you perform karyotyping and evaluate levels of serum testosterone to investigate if the patient has male or female genotype. And androgen insensitivity to be ruled out. So just in case if the uterus is present, we got to exclude certain things such as imperforate hymen, vaginal atresia as we discussed, and transverse vaginal septum. So we got to evaluate the levels of FSH. So just in case if the levels of SHS is high, we could be primary ovarian insufficiency. In case of Turner syndrome, Swyer syndrome, and you also have premature ovarian failure, these are some of the cases where there would be increased secretion of the follicle stimulating hormone. And just in case during evaluation if the follicle stimulating hormone levels are normal or reduced, it could be constitutional growth delay, or it could be hypogonadotrophic hypogonadism. Alright. And also we got to rule out hypothyroidism and hyperprolactinemia, right? So in that situation, there would be decreased secretion of follicle stimulating hormone and luteinizing hormone, and it could also be malnourishment It could indicate chronic illness and anorexia. And also we got to rule out galactorrhea, check if the patient has galactorrhea, and increased blood pressure shows congenital adrenal hyperplasia. So these are the possible diagnostics we can use to evaluate the presence of primary amenorrhea. Alright, so now we'll discuss the treatment of primary amenorrhea. So usually the treatment, it depends on the underlying disease. Alright, so the next is treatment. So the treatment is the management of underlying disease, and in case of any anatomical abnormalities, we could perform surgery, and in case of hypogonadism, hormone replacement therapy is suggested. So the overall goal of treatment is progression of normal pubertal development. So now, I hope you guys are clear about the primary amenorrhea. Now we'll study about secondary amenorrhea. So the secondary amenorrhea can be defined as the absence of menses for more than 3 months. So absence of menses for more than 3 months in individuals with previously regular cycles. Or it could be absence of menses for more than 6 months in individuals with previously irregular cycles. Alright, so speaking about the etiology or the causes of secondary amenorrhea, the first one is pregnancy. So pregnancy is the most common cause. It could be ovarian disorders such as premature ovarian failure, or it could be polycystic ovarian syndrome. And there are certain medications that can cause secondary amenorrhea, such as antipsychotics, chemotherapy, or oral contraceptives. Right? And it could be hypothyroidism. So because of decreased secretion of T3 and T4, there will be increase in thyroid receptor hormones, the thyrotrophin releasing hormone, So we also know that thyrotrophin releasing hormone is responsible for the stimulation of prolactin in pituitary gland. Alright, so that results in decreased secretion of gonadotrophin releasing hormone as well as decreased secretion of estrogens that could cause secondary amenorrhea, and it could be hyperthyroidism, hyperprolactinemia, Sheehan syndrome, Asherman syndrome, Cushing syndrome, adrenal insufficiency, and it could be hyper or hypogonadotrophic hypogonadism. Alright, so it also could be due to functional hypothalamic amenorrhea. So this can also cause secondary amenorrhea. This occurs in patients, in females who perform excessive exercises. For the females who has intake of reduced calories, or it could also be female athletic triad syndrome. So athletes usually have secondary amenorrhea because of menstrual dysfunction, calorie deficit, and because of decreased bone density. So this is the triad of female athlete triad syndrome. So functional hypothalamic amenorrhea is a dysfunction in pulsatile secretion of GnRH, which is the gonadotrophin releasing hormone. So as we all know, so because of this there is decreased fat and cortisol is increased, because of which through negative feedback mechanism the gonadotrophin releasing hormone is secreted in decreased levels, and that causes decreased secretion of follicle stimulating hormone as well as luteinizing hormone. That results in decreased secretion of estrogen, which causes secondary amenorrhea, or it could be anovulation, and finally the female presents with infertility. So these are the causes of secondary amenorrhea. So speaking about the clinical features, as you already know, the clinical feature usually depends on the underlying disease. So clinical features, it depends on underlying disease, right? Next we'll study about the diagnostics of secondary amenorrhea. So the very first thing we got to perform is to evaluate the pregnancy test, right? So the diagnostics. So number 1, pregnancy test. So if the pregnancy test is negative, we got to evaluate the levels of FSH, TSH and prolactin levels. If there is increased secretion of follicle stimulating hormone, we shall suspect ovarian insufficiency, and if there is increase of TSH, we could suspect hypothyroidism, and if there is increased secretion of increased prolactin values in lab test, we got to evaluate history of medications taken by the patients, such as antipsychotics and many other medications as we discussed in etiology, and you suggest brain MRI to rule out pituitary adenoma. And you also perform progestin challenge, where the patient are advised to take progesterone for 10 days. So if withdrawal bleeding is induced, we shall suspect polycystic ovarian syndrome or premature ovarian failure. If there is no withdrawal bleeding, we shall suspect uterine abnormalities, or it could be estrogen deficiency, right? And evaluate the values of FSH for further evaluation. Alright, so these are the diagnostic procedures which could be performed for secondary amenorrhea. So speaking about the treatment, so the treatment always depends on the underlying cause. So treatment. So management of underlying cause. So presence of tumors can be rectified by surgical resection, and in case of prolactinoma, dopamine agonist such as cabergoline can be given. And just in case if the female is trying to conceive, we shall perform stimulation of ovulation with gonadotropin. If it fails, assisted reproductive technology can be used for the patient who is trying to conceive. And just in case of premature ovarian failure, we shall suggest combined oral contraceptive pills or hormone replacement therapy can also be done. So I hope you guys are clear with amenorrhea, its types. So I'll give you a heads up on the next video studying about the further menstrual abnormalities. Thank you for watching.